Today, we are cracking open the secret language of mental health. It's this whole system of codes that turns the incredible complexities of the human mind into a language that doctors, researchers, and, insurance companies can all understand. So let's decode it together.
So let me start with a question for you. What could possibly connect something as complex as schizophrenia with a, pretty straightforward physical injury like a broken arm? I mean, on the surface, they feel like they belong in completely different universes, right?
Well, the answer is they both have a code, a specific little identifier that plugs them into this giant universal system that's designed to organize every single thing that can happen to the human body. And our guide for this whole explainer comes straight from the source, a medical coding textbook. This is the actual blueprint that healthcare professionals and administrators use every single day.
The system is called ICD-10-CM. Yeah, I know, it's a bit of a mouthful, but what's really important is what it does. You can basically think of it as the universal language for all of medicine. Every cold, every cancer, every mental health condition, it gets a code in the system.
Probably the easiest way to wrap your head around it is this. It's like the Dewey Decimal System you'd find in a library. But instead of organizing books, it organizes the entire spectrum of human health and disease. Each code points to a very specific condition on a very specific shelf in this huge library of medical knowledge. Okay, so how does a massive system like this even begin to handle something as nuanced and complex as the human mind? Well, let's dive into Chapter 5, which is the section dedicated entirely to decoding mental disorders. So everything related to our mental and behavioral health gets filed into this one chapter. And inside that chapter, things are grouped really logically. For instance, all schizophrenia-related codes, they start with F20. Mood disorders like depression, you'll find those in the F30s. Anxiety, the F40s. It's all about creating a clear structure.
And we can see exactly how this works in practice. So take schizophrenia. Its main category, kind of like its main shelf in the library, is F20. That one code tells any medical professional the general diagnosis we're dealing with.
But here's where it gets really powerful. It doesn't just stop there. The system gets incredibly specific by adding a decimal point. So F20.0 isn't just schizophrenia, it's the paranoid type. F20.2 is the catatonic type. And that tiny bit of extra detail, that precision is everything. It guides treatment, it helps researchers spot trends, and it just makes sure everyone is speaking the exact same language. Let's dig into that idea of precision a little more, because in some areas, this level of detail isn't just helpful, it's absolutely critical. Let's take a look at substance-related disorders. You know, in our day-to-day conversations, we kind of throw around words like use, abuse, and dependence almost interchangeably. The lines can get really blurry. But in the world of medical coding, these words have sharp, distinct, non-negotiable meanings. And this is where the textbook draws a very clear line in the sand. Abuse is defined as problematic use, and this is the key detail, without physical dependence. Dependence, on the other hand, is when the body has actually adapted. It means there's a higher tolerance, a compulsion to keep going, and often withdrawal symptoms if the person stops. They are two clinically different things. And of course, the codes reflect that clinical difference perfectly. I mean, they look almost identical, but that one little number after the decimal point changes everything. Alcohol abuse is coded F10.1. Alcohol dependence is F10.2. A whole world of difference captured in just one digit. So that raises a question, right? What happens if a patient's chart mentions both? Well, the system has a clear hierarchy. The rule is simple. The more severe condition always wins. If both abuse and dependence are noted, you only code for dependence. It's a logical rule that makes sure the most significant diagnosis is always front and center.
All right, but this system doesn't just diagnose the problem, it also has to track the solution. So for our next section, let's see how the actual therapy gets coded.
And here's a really important distinction. A diagnosis code tells us what the problem is, but a procedure code tells us what was done about it. For that, there's a separate but related system called ICD-10-PCS. That P stands for Procedure Coding System. And here you can see what some of those procedure codes actually look like. They might seem like a random jumble of letters, but each one points to a very specific therapeutic action.
A code starting with GZ2 might be crisis intervention. GZB is for electroconvulsive therapy. GZH is for group psychotherapy.
And no surprise, just like with diagnoses, the procedure codes get super specific. Substance abuse treatments have their own dedicated section, with unique codes for services like detox, one-on-one counseling, or medication management. The system really does capture the entire journey.
Okay, so we have codes for diagnoses and codes for treatments, but what's the big picture here? I mean, why go to all this trouble to turn the human condition into a series of letters and numbers?
Well, it matters for three massive reasons. First, patient care. It creates that universal language so any doctor anywhere can understand a patient's history. Second, billing. Let's be honest, it's the foundation of the entire healthcare payment system. No code, no payment. It's that simple. And third, and this one's huge, research. It lets scientists analyze data from millions of patients to track diseases and figure out which treatments actually work best.
Now, here's one last really fascinating wrinkle in this whole story. This quote from our source material reveals that psychiatrists often don't speak in ICD-10 code at first. They use a totally different manual, the DSM, the Diagnostic and Statistical Manual of Mental Disorders. So what does that really mean? It means that behind the scenes of your healthcare, there is this constant act of translation going on. A clinician makes a diagnosis using the language of the DSM, and then a medical coder has to translate it into the correct ICD-10 code for the official record. It's this completely invisible but absolutely vital step. And that kind of leaves us with a final, much bigger thought. This whole system is an incredible achievement in organization. There's no doubt about it. But it also brings up a pretty profound question. As we get better and better at classifying and coding the human mind, how do we balance that need for clean, standardized data with the messy, complex, and unique reality of every single person? It's a fascinating challenge, and that's what we wanted to dig into today. Thanks for joining us.